Well, amid the second wave and the raging pandemic, a third wave of COVID-19 is inevitable. This is what the government's top scientific advisor has said, warning that vaccines will need to be updated in order to deal with the new strains of COVID-19 in India that have overwhelmed hospitals and left thousands dead. Now, asked if a nationwide lockdown was the only solution to contain this unprecedented rise in COVID-19 cases, Niti Aayog member and the chief of the National Expert Group on Vaccines, Dr. V.K. Paul, has said that if anything more is required, those options are being discussed, in a certain sense hinting at the possibility that a national lockdown is something that the government is discussing. Listen in.
जब वायरस का स्प्रेड बढ़ता है, एक्सेसिव होता है, तो चेन्स ऑफ ट्रांसमिशन को रोकने के जो बाकी एफर्ट्स हैं उनके साथ में रिस्ट्रिक्शंस को भी बीच में लाया जाता है। और इस कॉन्टेक्स्ट में 29 अप्रैल को डिटेल गाइडलाइन इशू करी गई हैं। दोज ऑप्शंस आर ऑलवेज बीइंग डिस्कस्ड एंड दोज डिसीजंस एज रिक्वायर्ड विल बी टेकन, बट एट द सेम टाइम रिमेंबर this already there is a very significant guidance to the states to impose and impose restrictions in order to suppress the chains of transmission.
Where does SARS coronavirus 2 go from here? A phase 3 is inevitable given the high levels of circulating virus, but it's not clear on what time scale this phase 3 will occur. Hopefully incrementally, but we should prepare for new waves. Previous infections and vaccines will cause adaptive pressure on the virus for new kinds of changes which try to escape it. And therefore we should be prepared by scientifically to take care of that. So B117, other variants like 617 are accumulating changes which show excellent vaccines, on which vaccines show excellent efficacy, but ongoing surveillance is needed and vaccine updates as we go ahead with new kinds of variants are inevitable.
Well, almost all states and union territories of India currently are reporting a positivity rate of over 5%. Now, this is the government's threshold. This is the number of tests that are turning out to be positive. But 24 of these are very high, above the 15% mark. The worst hit at the moment is Goa at 48% positivity rate, Haryana at 37%. Bengal, which recently saw elections and overcrowding, 33%, and Delhi, which continues to remain hard hit at 32%. Now, here's a worrying story that we are tracking from Maharashtra. While the total number of cases on a daily basis have dropped, the number of deaths have increased. Maharashtra on Wednesday reported a record of 920 new deaths from COVID-19 and over 57,000 cases, even as authorities said that some of the worst hit districts in the state are actually showing a declining trend in infections. These figures come on a day when the Supreme Court praised Maharashtra's handling of the second wave of infections, recommending that the centre take notes from the Mumbai model to try and ensure oxygen supplies to Delhi. It also refused to stop the High Court from monitoring the oxygen situation. Maharashtra Health Minister Rajesh Tope on Tuesday evening said that 15 districts in the state, the worst affected state with around 6.6 lakh active cases, are showing a decline in coronavirus cases.
हाँ, ही गोष्ट खरी आहे की महाराष्ट्रामधल्या काही जिल्ह्यांमध्ये रुग्णवाढ थोडीशी उतरायला लागलेली आहे, पण त्याच बरोबरीने काही जिल्ह्यांमध्ये रुग्णवाढ थोडीशी व्हायला लागलेली आहे. आता केंद्र सरकारच्या विज्ञान विषयक सल्लागारांनी एक इशारा दिलेला आहे की देशामध्ये तिसरी लाट येते आहे, सावध रहा. सावध रहा म्हणजे काय करायचं? तर नवीन काही नाही आहे त्याच गोष्टी. आपण काय करतो आहोत, सावध काय राहतो आहोत.
All right. Well, the Supreme Court on Wednesday asked the centre and the Delhi government to take note of the Mumbai model of COVID-19 management and see if the same can be replicated in the national capital.
इस वक्त मैं बीएमसी हेडक्वार्टर में मौजूद हूं इसलिए क्योंकि मुंबई मॉडल की तारीफ सुप्रीम कोर्ट ने की है, बीएमसी की तारीफ सुप्रीम कोर्ट ने की है। न सिर्फ दिल्ली सरकार को बल्कि केंद्र सरकार को भी कहा कि आप मुंबई महानगर पालिका से बात करें, क्योंकि ऑक्सीजन की किल्लत पर सुप्रीम कोर्ट सुनवाई कर रहा था और उस दौरान ये भी सुप्रीम कोर्ट ने माना कि किस तरह से मुंबई महाराष्ट्र में ऑक्सीजन की किल्लत थी, लेकिन कुछ ही दिनों में किस तरह से इसे ठीक कर लिया गया। तो क्या स्ट्रैटेजी अपनाई गई, इसको लेकर मुंबई महानगर पालिका से आप समझें, ये सुझाव दिया गया। और इस वक्त मैं मुंबई के बीएमसी के म्यूनिसिपल एडिशनल कमिश्नर सुरेश काकानी जी के साथ हूं, हेल्थ विभाग के। इनके ऊपर एक साल से जो जिम्मा है कोरोना महामारी को संभालने का। सर बहुत बहुत शुक्रिया हमसे जुड़ने के लिए। सिटी सेंटर शो की आपसे मैं शुरुआत कर रही हूं। जो आज ठप्पा सुप्रीम कोर्ट ने लगा दिया है कि आपने संक्रमण पर काबू पाया, न सिर्फ इतना कि ऑक्सीजन की जो किल्लत थी उसको भी ठीक किया, इस टिप्पणी पर सबसे पहले आपकी प्रतिक्रिया क्या है?
टिप्पणी से पाकर तो खुशी तो हुई है, लेकिन जिम्मेदारी का एहसास और बढ़ गया है और हमको तेज़ी से भी काम करना पड़ेगा और भी हमको ज़्यादा काम करना पड़ेगा, इसका भी एहसास हमको है और हम उस दिशा में हम आगे बढ़ रहे हैं, आगे चल रहे हैं।
मुंबई मॉडल क्या रहा सर?
बेसिक जो चीज़ें हैं जैसे ट्रैकिंग करना, टेस्टिंग करना, ट्रीटिंग करना, उनको ट्रीट करना पड़ेगा। और साथ में मुंबई का जो जियोग्राफिकल लिमिटेशंस है उसमें डेंसिटी, पॉपुलेशन डेंसिटी बहुत ज़्यादा है, तो कोई घनी आबादी वाले इलाकों में से लोगों को बाहर करके क्वारंटाइन सेंटर में शिफ्ट करना, उनका इलाज करवाना, उनकी टेस्टिंग करवाना, टेस्टिंग में अगर पाए जाते तो उन पर फिर से आइसोलेशन सेंटर में दाखिल कराना। इसके साथ ही हमने जो बाकी जो बिल्डिंग है वो सेम मॉडल हमने बिल्डिंगों में भी लगाया। बिल्डिंग में भी जो भी हमने बिल्डिंग सील की थी उनका भी टेस्टिंग करके जो पॉजिटिव पाए गए उनको ट्रीटमेंट के लिए दाखिल कराना। या तो अगर होम आइसोलेशन में है तो हमारे जो वार्ड रूम है, जो हमारा डिसेंट्रलाइज सिस्टम जो था वो काफ़ी हमको फ़ायदेमंद साबित हुआ, ताकि हर पेशेंट पे हम नज़र रख सके। पहले हमारी जो सिस्टम थी वो ऑक्सीजन जो सप्लाई सिस्टम थी वो सिलेंडर बेस्ड सिस्टम थी, सिलेंडर लाओ, सिलेंडर लगा दो और बाद में रिफिलिंग कर लो। तो हमने ऐसा डिसीजन लिया कि जो सप्लाई सिस्टम हमारी वो सेंट्रलाइज सप्लाई सिस्टम हो, ताकि एक बड़ा टैंक रहे, उसमें 13,000 लीटर या 26,000 लीटर की कैपेसिटी रहे और पाइपलाइन द्वारा हम ऑक्सीजन सप्लाई करें। उसकी वजह से रेगुलर सप्लाई शुरू हुआ, 20 to 30% उसमें बचत हुई और एक कॉन्फिडेंस आया कि ठीक है अभी हमारे पास में ऑक्सीजन है, तो घबराहट जो होती है वो नहीं होती थी।
From Maharashtra, let's now shift our focus to Kerala, which continues to see a spike in daily COVID cases, this time crossing the 40,000 mark, with 41,953 cases reported on Wednesday. Chief Minister Pinarayi Vijayan has in fact raised concerns over the fast decreasing oxygen as cases continue to surge. This, of course, is a big story that we're tracking from Kerala at the moment. Cases have crossed the 41,000 mark for the very first time. This is the highest ever as far as Kerala is concerned. The positivity rate in the state is above 25%, even though this positivity rate is not the highest, it's actually dipped. Kerala Chief Minister is now saying that the oxygen stock in the state is decreasing rapidly as cases continue to surge. Sneha joins us with the very latest. Sneha, the Kerala Chief Minister has written to the Prime Minister about the depleting stock of oxygen in Kerala.
Well, that's right. In fact, if you look at the cases, there's been a steady spike in cases. We've crossed the 40K mark on Wednesday as the highest daily record cases. There are districts which are again, showing continuously daily record high cases. And the Chief Minister has said that the oxygen is being used at a much faster pace. The demand is only increasing. So the Chief Minister has gone ahead and written to the Minister seeking for 1,000 tons of liquid medical oxygen, asking that it should be given from the current import quota as well as those that will be coming in later on. But he says that to augment the capacity and the availability of liquid oxygen in the state, Kerala will require central government support. And if you look at the capacity also, now it's been augmented. At least the state government claiming that around 38.7 ICU beds in the government hospitals are available. 72% ventilators in government hospitals are available. There was a time where a lot of private hospitals were saying that they're running full capacity. Some of them have been able to increase their capacity. The state government has also ordered that 50% of the beds in these hospitals need to be reserved for COVID patients. So a lot of capacity is happening.
All right, Sneha, we seem to be losing that line with you, but this, of course, is the worrying development that we're tracking from Kerala. Highest daily cases at close to 42,000 being reported in the state for the very first time. Positivity rate of 25%, and the Chief Minister there writing to the Prime Minister saying that the medical oxygen stock in Kerala is also depleting quickly. Let's now shift our focus to the other big development that we're tracking. The Supreme Court has set a deadline on an oxygen plan. The Supreme Court has said that it needs a comprehensive plan to be submitted today by 11 a.m. So this, of course, is the big development that we're tracking. Remember, the centre must submit a plan by 11 a.m. on what is the plan of action to supply 700 metric tons of oxygen to the national capital. Also, the Supreme Court, remember, has said that Mumbai has seen a decline in daily cases and deaths, and this is now a Mumbai model that Delhi should in fact learn from. So it is going to be extremely interesting to see what really happens in the Supreme Court at that 11 a.m. deadline. We'll continue to track that story for you very closely. Moving on, viral videos have emerged from a hospital in Gurugram where relatives can be seen running around and alleging that hospital staff abandoned ICU patients and ran away. This after the hospital ran out of oxygen. The video is from the Kriti Hospital in Gurgaon Sector 56 where 6 people lost their lives last Friday night on the 30th of April due to a shortage in oxygen supply. In the video, you can see empty chairs and patients' relatives asking the police why the hospital staff is missing. The hospital director, Dr. Swati Rathore, told NDTV that despite raising an alarm over oxygen shortage, they got no help.
ना मेडिकोज में कोई है, यहाँ कोई नहीं है, इधर कोई नहीं है, ना डॉक्टर है, ना कोई है, और ना रिसेप्शन में कोई है, और ना कोई गार्ड है यहाँ पर, सब भाग लिए, ना मेडिकोज में कोई है, यहाँ कोई नहीं है, इधर कोई नहीं है, ना डॉक्टर है, ना कोई है, और ना रिसेप्शन में कोई है, और ना कोई गार्ड है यहाँ पर, सब भाग लिए, ना मेडिकोज में कोई है, यहाँ कोई नहीं है, इधर कोई नहीं है, ना डॉक्टर।
सर आपके होते हुए डॉक्टर लोग कैसे भाग सकते हैं? सारे पेशेंट को अंदर डेथ छोड़ के
हम नहीं बन सकते डॉक्टर को, हम जानते हैं डॉक्टर ही हो। नहीं कहाँ से?
यार कोई क्राइम करके जाएगा, आप रोक नहीं सकते उसको।
सब लिख रखिए क्या? गरम नहीं ठंडा।
भाई साहब जिसके घर से 2 बंदे जाते हैं ना उसको पता होता है गरम या ठंडा। आपके होते हुए यार कैसे जा सकते हो?
हम किसी को बन सकते हैं क्या?
Now, the hospital director has claimed that she asked the staff to hide in the canteen to save their own lives, as just 6 days ago, that is on the 24th of April, attendants of other patients had violently assaulted their staff and an FIR had been registered by the hospital. The footage you see is of the day when the hospital staff were beaten up. And in the pictures you'll now see, you can see frantic relatives knocking on the ICU door, and inside the ICU, dead patients.
सारे मरे पड़े।
क्या हो रहा है?
ये इनके जो अटेंडेंट बैठे हैं यहाँ पे, आप अंदर जाके गेट बंद कर दिया।
बाहर चलो जी,
बस बस
देखो माँ इधर इधर
डेड डेड सब ऐसे ही पड़े रहे।
We are currently standing outside the Kriti Hospital in Sector 56 in Gurgaon. This is in news right now because there has been a constant oxygen shortage at this hospital like many others. But here on Friday night, 6 people lost their lives due to oxygen shortage at this hospital. Now you see oxygen cylinders here, supplies a little better since last Friday after this incident happened and 6 people lost their lives. What exactly happened that night on Friday is that according to hospital director Dr. Swati Rathore. We spoke to her, and what she told us is that since 2 p.m. in the afternoon, they had been raising SOS alarms to all the authorities, all the government authorities. They had been asking them, telling them that they are running out of oxygen in this hospital. At that point, the 6 people who lost their lives that night included 3 people who were in the ICU and 3 people who had been in the regular wards. A total of 15 COVID patients were present in this hospital at that point. This is a 50-bedded hospital. Since 2 p.m. they started raising SOS calls, but nobody was addressing their calls. No authorities came to their rescue. By 11 p.m. they ran out of oxygen. 6 people lost their lives, 3 in the ICU, 3 in the regular wards. And that is when even relatives of patients started running around. They tried to also vandalize the hospital here, tried to look for staff, but there was none to be found anywhere. There are videos that have emerged from that night where relatives are going around asking for help, but there is no hospital staff present at that moment. Later, the police came in, tried to help the situation out. The police also brought certain oxygen cylinders. Now, according to the hospital director, she says that because just last week there had been another incident where many of the relatives had tried to attack the hospital staff over the issue of oxygen shortage. That is why she asked that night for a hospital staff to run to safety as soon as she realized that there had been casualties, because she said that my staff would also have ended up losing their lives. And just last week there are very clear videos where their staff did also face physical harm. She also had lodged a police complaint for the incident that had happened just the last week prior to this incident. In Gurgaon with camera person Sushil Rathi, this is Sukirti Dwivedi for NDTV.
Welcome back. Let's get you up to speed with the top story that we're tracking from Bengal. Well, as far as the numbers are concerned, there have been 18,102 new cases, over 100 deaths that have in fact taken place. New infections there rising by 18,000. I remember fresh curbs have been put in place in Bengal. Over 100 deaths have been reported 3 times in the last 5 days, and the positivity rate is at 8.55%. Local trains in Kolkata will come to a halt from today as the government has announced new restrictions to curb the spread of coronavirus, while shops will have to be staggered timings to operate. Offices and establishments will have 50% capacity. Mamata Banerjee has written to the Prime Minister after taking over as Chief Minister yesterday, demanding a transparent policy on vaccines. And remember, Mamata Banerjee took oath for the 3rd time after the TMC's win in Bengal. Here's the full story.
আমি মমতা ব্যানার্জি ঈশ্বরের নামে শপথ করিতেছি।
Taking oath for the 3rd time, West Bengal Chief Minister Mamata Banerjee, the only woman Chief Minister in the country today, she joins a club of just 3 other women who have served as Chief Minister for 3 whole terms and more: Jayalalitha, Mayawati and Rabri Devi. Mamata Banerjee's fight for her 3rd term was monumental. It boiled down to a Mamata versus Modi fight, one that she won decisively. The result could impact India's political future.
Please take proper care যাতে কোনো ভায়োলেন্স কোথাও না হয় এবং কোথাও কোথাও ইলেকশনের পরে কিছু স্পোরাডিক ইনসিডেন্ট হয়। আমি আজ থেকে ল এন্ড অর্ডার ট্যাকেল করব এবং কঠোর হস্তে আমি এগুলো মোকাবিলা করব। এটা আমার 2nd কাজ।
At the swearing in itself signals of stormy times ahead. The governor and she sparring over post-poll violence.
যাতে কোনো রকম কোনো অশান্তি কোথাও না হয়, আর যদি কেউ অশান্তি করে তার বিরুদ্ধে কড়া পদক্ষেপ নিতে আমি কিন্তু পেছপা হব না।
The stance of that vandalism, the nature of attacks, killings, injuries, arson, loot, that can't be allowed, that cannot be overlooked, and have my assurance that shall not be overlooked.
At least a dozen people have died, and Mamata Banerjee has called for calm. But she and her party have accused BJP of churning out fake news, a claim confirmed by fact-checkers.
अगस्त 1946 जब मैं याद करता हूं, डायरेक्ट एक्शन डे की बात करता हूं, तो मैं उसी के साथ साथ आज जो 2 तारीख की दोपहर के बाद घटनाएं घटी हैं, that also is like a Khela Hobe day.
Mamata Banerjee has flagged BJP's claims as attempts to fan communal tension. JP Nadda, steering BJP protests, locked horns.
BJP is famous for fake news. Their fake news master, Amit Mallavia, is sitting here spreading fake news. But these fake news wallas made no difference to the election. They will make no difference now.
Third time lucky, they say, but Mamata Banerjee is kicking off her third term with 3 battles to fight: post-poll violence, COVID and the BJP, which is smarting from its defeat and in no mood to ease the pressure on her. With Saurav Gupta, Monideepa Banerjee, NDTV.
All right, let's now shift our focus to the big political story we're tracking from Uttar Pradesh. The BJP has suffered a huge setback in the Uttar Pradesh Panchayat polls. Counting is still underway, but the BJP has leads in only 666 out of the 3,050 seats. Samajwadi Party is leading in 747 of the 3,050 seats. The other leads are smaller parties and a large chunk of independents. Well, what should have the BJP worried is the loss of face in places that have a tremendous socio-religious significance for the party. Ayodhya, for instance, the BJP is winning in 6 out of 40 seats. Varanasi, there are 40 seats in Varanasi. The BJP has won just 8 out of 40. In Mathura, in Prayagraj and in Gorakhpur, the party is suffering big losses. In Prayagraj, there are 84 seats. The BJP has won 14. The Chief Minister's constituency, remember, Gorakhpur has 68 seats. The BJP has got only 28. So a setback for the Yogi Adityanath government. And the Uttar Pradesh government, remember, went ahead with these polls despite calls for postponement in the midst of a pandemic. It is worrying news for the BJP in its stronghold of Uttar Pradesh ahead of the assembly elections in the state next year. All right, the big story that we're tracking from Assam, there is a rapid surge in COVID-19 cases across the state of Assam. In fact, the latest shocking story that we're tracking is 90 workers and staff members at the Zaluni Tea Garden in Assam have tested positive. This is the tea garden in Upper Assam, Dibrugarh district. The Dibrugarh district administration has declared this tea estate as a containment zone and shut down the garden. Now, tea-based organizations, remember, have been demanding vaccination in the tea garden areas on priority, since there is a possibility that COVID would spread faster in tea gardens, given the fact that workers in the gardens work in close proximity. My colleague Ratnadeep, tracking the details of the story, joins us with the very latest. Ratnadeep, cases in Assam continue to rise. This has been something that we've seen. We know that educational institutions have been shut down from today. Meanwhile, what you're reporting on is this worrying cluster of infections that's emerged in the tea gardens.
That's right. In fact, Assam is actually turning grim in terms of the COVID-19 situation, given the fact that for the past couple of days, more than 4,000 cases have been reported per day. And yesterday, actually, Assam recorded its highest death of 55 people, and that's why perhaps the government has imposed new restrictions as far as with containment zones and reducing the time of opening up of shops and business establishment. But one of the major reason of worry had been the tea garden areas. Remember, the tea garden areas, particularly in Upper Assam, are areas which are otherwise isolated. And in the first wave of COVID, we didn't see much of infections among the tea garden workers, which, remember, they are most vulnerable because they live in labor lines, and where social distancing is a problem. Hygiene issues are there in the tea garden areas, particularly among the labor lines. Assam has more than 800 tea gardens and lakhs of workers work there. But yesterday, what has raised alarm is that 90 workers and staff members of a tea garden in Upper Assam have been tested positive. Now that garden has been turned into a containment zone. Now vaccination process has started in that tea garden and more testing is being done. But what is alarming is that if this kind of trend continues in other tea gardens, then it will lead to a major crisis, and that is something that now the administration is looking forward to how to contain it. Also, the fact that in Assam, with the number of positive cases, number of symptomatic cases increasing, there is acute pressure developing on the number of beds available. Particularly in Guwahati, also the beds are running out, and therefore now the government has reached out to the Indian Railways, the Northeast Frontier Railways, which mans the railway operations in the Northeast, has come up with railway isolation centers. These are railway coaches which have been turned into isolation centers for treating mild symptomatic patients, about 150 coaches, in which each of the coach can actually allow 16 people to be treated. We did visit one of the isolation center, and here is a report for our viewers.
Number of COVID cases in Assam increasing in an alarming rate. One of the key concerns for the government is COVID beds, because not only in Assam, there is a sharp spike in number of COVID cases across Northeast, and number of beds is limited in this region. In fact, Assam has been reporting more than 4,000 cases, and that's why now the government has sought help from the Indian Railways. The Northeast Frontier Railways, which serves the northeastern region, has now turned 150 of its coaches into COVID isolation centers. Now, this is one of such coach which has been turned into a COVID isolation center of the Northeastern Frontier Railway. If I can ask my camera person to go inside, you can see now this coach has been turned into an isolation center. These beds have been made ready, and here patients with mild COVID symptoms would be kept. Now in each of the coaches there are 16 berths which has been reserved for COVID patients. These coaches are ready and they can move anywhere in Northeast whenever each of the state government would put in a requisition. In fact, Assam government has already put in a requisition. Now there are also provisions here. Apart from these beds, there are also provision where you can place oxygen cylinder as required. Railways doctors will also help the doctors of the state government to man these COVID isolation centers, and the platforms where these COVID isolation coaches of Indian Railway will be kept will be completely sealed. No other people will be allowed to enter those platforms. At this moment, there is already one COVID isolation train placed at Guwahati railway station with 20 coaches. Each coaches have provision to keep 16 patients, and more such trains are ready to go across Assam and across Northeast at a time when Assam and the entire Northeast region is witnessing a spike in the number of COVID patients. This time the number of symptomatic patients is more, and therefore in Northeast the real concern is if these numbers keep on increasing, they will run out of beds, and at that point of time, at least for mild COVID cases, these isolation coaches will be used. In Guwahati, Ratndeep Chaudhary for NDTV.
All right, from Assam, let's now shift our focus to Rajasthan, where COVID cases in Rajasthan have been breaching the 15,000 plus mark each day. And while there are districts like Jodhpur, Jaipur, Udaipur and Kota with a high urban population, they are accounting for the maximum number of cases. But in rural Rajasthan, it's also equally affected. In fact, districts like Chittorgarh, Pratapgarh, Dungarpur and Sikar, home to large population of migrant labour who work in Gujarat and Maharashtra, also reporting a record number of cases.
The Chittorgarh District Hospital in Rajasthan. 230 out of 400 beds in this government facility are oxygen beds. They are all full. Some patients can be seen occupying space on the floor. With a peak of 736 cases and over 400 to 500 cases every day, Chittor, with a high population of migrants, is one of the worst affected rural districts in Rajasthan.
कोविड का जो ये दूसरी लहर है उसमें चित्तौड़गढ़ जिले में ग्रामीण क्षेत्र से हमारे पास काफ़ी मरीज आ रहे हैं और एक अज्ञानतावश वो टेस्ट नहीं करवाते, बीमारी गंभीर होने के बाद में जो काफ़ी लेट स्टेज में यहाँ प्रेजेंट कर रहे हैं और उसकी वजह से जो उनके इलाज में भी काफ़ी दिक्कत आती है और जब तक संक्रमण काफ़ी ग्रामीण क्षेत्र में फैल चुका होता है.
41% of COVID cases are being reported from rural areas. In Sikar district in one village, Maharoli, more than 50 cases were reported.
हमारे यहाँ की पॉपुलेशन समथिंग 10,000 है और यहाँ की स्थिति है कि हमारे यहाँ पे कोविड में पिछली बार तो कोई भी पेशेंट नहीं था, इस बार बहुत ज्यादा पेशेंट है और जो मजदूर लोग हैं बाहर से आ रहे हैं.
Rural Rajasthan has been hit like never before. All 33 districts in the state are reporting above 100 cases each day. Apart from the lack of awareness, returning migrants is another reason for the spike.
संस्थागत रखा गया था, उसमें बाहर से आने वालों को वहाँ रखा जाता था संस्थागत क्वारंटाइन, लेकिन इस बार कोई व्यवस्था नहीं होने से बहुत सारे तो संक्रमित है जो अपने घरों में रह रहे हैं और उनके घर वाले हमारे बीच में रह रहे हैं.
Village people on the periphery of big cities say they have decided to stay away from big towns for now.
कौन जाए सा महाराज, जयपुर में जाए कोड़ जाए इंडे रह जाए तो सब घर बैठे से काम करवाई कौन जाए कोड़ नहीं बैठे.
हमारे गांव में हमारा एक समाज कल्याण केंद्र है, वहाँ पर हमने एक कोविड सेंटर भी बना रखा है. तो जो भी कोई अगर ऐसे कोई भी ग्रामवासी है जिसको इसमें लक्षण हो तो वो कोविड सेंटर में आकर यहाँ पर रह सकता है.
Rajasthan is geographically India's largest state, and to reach medical help like oxygen and life-saving drugs as the virus spreads in rural areas is the state government's biggest challenge. With Salman in Chittor and BL Saroj in Sikar, in Jaipur, Harsha Kumari Singh, NDTV.
From Rajasthan, let's now get you an update from Tamil Nadu. Amid a surge in COVID-19 cases, Tamil Nadu is also going to have new lockdown-like restrictions in place from today till the 20th. All shops except food, medicine and labs would remain shut. Only 50% seating capacity allowed in public transport. Government and private offices can have only 50% staff. While there will be no dining in restaurants, liquor shops have been permitted till noon. With M.K. Stalin all set to be sworn in as the Chief Minister tomorrow, he's asked the Chief Secretary to open a war room as a part of a COVID containment strategy. Let's go right across to Sam Daniel joining us with the very latest. Sam, whole host of restrictions and measures there to contain the spread of COVID in Tamil Nadu. What more can you tell us?
That's right, Rishika. That's because the daily tally in Tamil Nadu has crossed 23,000. Over the last 24 hours, 167 people have died, and the government feels this kind of a restriction till the 20th could help them to break the chain and to start the flattening of the curve process in that sense. Hospitals are also beginning to run their full capacity, so that's a major challenge, not just in Chennai but across Tamil Nadu. And as we speak now, I come to you from the East Coast Road where all the shops remain shut, but the shop with an orange board behind this car, that's a liquor shop, and that would remain open till noon. And these shops have been exempted under the government establishments category. But otherwise, even shops selling vegetable, milk, they have to shut down by 12 o'clock. Government offices can have only 50% staff. All public transports, including trains, metros, buses, can have only 50% of their seating capacity. This is because the positivity rate has crossed 15.6%. And tomorrow, M.K. Stalin would take over as Tamil Nadu Chief Minister, and he has also appealed to private hospitals to join hands with this mission of what he calls saving lives, asking them to allot more than 50% of beds for COVID treatment, to cancel elective procedures so that all that infrastructure can also be deployed for COVID treatment. He also wants them to offer concession in treatment for COVID across Tamil Nadu. And he has told the Tamil Nadu Chief Secretary to open a war room that would transparently give information in terms of availability of beds, ICU, oxygen, ventilators versus the requirements for these across Tamil Nadu, so that they will have a larger picture from districts. People can be moved to places where these are available to ensure they don't run short of these. And tomorrow morning at 9 o'clock, he would take over as Chief Minister. His party leaders say he is already having clear plans how to go about it, and that's going to be his first priority and challenge as well. Rishika.
All right, Sam, we'll continue to keep a close watch on all those developments. Appreciate you for joining us with the very latest. From Tamil Nadu, let's now shift our focus to Kerala, which continues to see a spike in daily COVID cases, this time crossing the 40,000 mark. There have been close to 42,000 cases actually reported on Wednesday, 41,953. The Chief Minister, Pinarayi Vijayan, has raised concerns over the fast decreasing oxygen in the state. Sneha joins us with the very latest. Sneha, an alarm there been sounded about oxygen supply in the state of Kerala as well. This as cases cross the 40,000 mark.
Well, that's right, Rishika. The cases, there's a record increase in daily cases. It's crossed the 40,000 mark. But let me also give you a sense of what's happening on the ground. You have police checkpoints at various places to ensure that only people who are involved in essential commute are out on the road. This as restrictions are in place for this week to ensure minimum movement from people. Even officers are being told to only work with 25% seating capacity or people present in their offices. So that being one. Now, secondly, as you mentioned about the Chief Minister writing to the Prime Minister for 1,000 metric tons of liquid medical oxygen that would be required, he's requested the Prime Minister to either provide half of it from the imports that are coming in currently, and later on another section from the other imports that will be eventually coming in. But the CM saying that with the surge in cases, the oxygen requirement has surged, and the availability is depleting very fast, and the state requires the centre's help to augment the availability of oxygen. Now, there's also other steps which are in place. There are districts which have started oxygen war room monitoring the availability of oxygen in each hospital and the supply that is being sent to them, the usage of this. That is happening in some districts. In the others, it's still to be set up. Orders have been given to even monitor this at the state level. That is something which is expected to come up in a day or two. So a lot of emphasis now in the state also to ensure that oxygen supplies don't fall short of, as it has been seen in several other states. So measures being taken in that regard. Now, what we are also being told is there are even nodal offices which have been positioned, say at Inox, which is the largest producer of medical oxygen in Kerala, to be able to facilitate or even streamline the movement of oxygen from that particular place, the production or the supply source to the hospital based on the verified needs of the hospital. So hospitals raise the demand. There's a cross-section of the administration that verifies that demand, and then the supply is released from, the supply points like Inox. So a lot of measures like that on the ground, even as strict restrictions are being seen across the state as well.
All right, Sneha, we're going to continue to keep a close watch on those developments from Kerala as well. So an early alarm in a certain sense has already been sounded on oxygen supply in the state of Kerala amid a huge spike in COVID-19 cases. We'll keep a close watch on those developments. Thanks for joining us. Let's shift our focus to Andhra Pradesh, where the government has denied that there is any new strain of COVID in Andhra Pradesh that's causing more infections or deaths in the state. Remember, there's been talk of an Andhra strain. The government's denied it for now. They say that it is the Maharashtra's double mutant strain that is now found in a majority of cases in Andhra Pradesh as well. Uma Sudhir with the full story.
There seem to be some reports that suggest that there is a strain of virus that seems to have a much smaller incubation period, and actually happening just within 3 to 4 days they're reaching criticality. Have you identified that as a separate strain of virus? What are the reports that you're getting?
We are in touch with CCMB, who are doing the genome sequencing for this and all. I've spoken to the scientists also there. This strain, I don't know who has started naming it AP strain. This is not something exclusive to Andhra Pradesh. This strain has been found from samples from the rest of southern part of India also. So naming it AP strain, I think, is not may not be correct. It's there in all parts of the southern India. And this strain was there prior to this B1617, B1618, which we call the double mutation strain, which was coming from other parts of the country. This was well before the double mutation strain was identified in the gene sequencing. And now this N440K, which they are calling wrongly as some Andhra strain and all, is being replaced by this double mutation strain, the latest of the gene sequence that PCMB is doing. And they are of the opinion that there are no large-scale studies or anything to confirm that it is replicating faster or it is either more lethal or more infectious. No studies have been done.
So the first wave suggested that there was a vulnerable group which is the elderly or something. Now the second wave seems to suggest that all age groups are becoming equally vulnerable. Is that your understanding also of the second wave?
Statistically, see, most of the things comes from anecdotal data. But statistically speaking, old and comorbid are the ones where the morbidity, that means mortality, is still higher. Younger age group, though being hospitalized, compared to last time, there might be a little bit of more mortality because positivity also in the younger age group is this time higher. So last time the younger age groups were not getting infected because maybe awareness level, education levels, different things and all. But this time we find that the younger age group is the age group which is getting infected more. So vis-a-vis infection and mortality, we see that this time the mortality is a little lower. Last time the mortality was, of course, statistically not very significant. Last time it was 0.81 for the state of AP. This round it is 0.74. Not very significant statistically, but the whole conception that more younger people are dying this time is not correct because more younger people are getting infected.
Welcome back. On to the other big story that we're tracking. In a span of just 48 hours, an oxygen plant has been set up by the DRDO at the All India Institute of Medical Sciences as a response to the shortage of medical oxygen that continues to be a big story as far as the national capital and several other parts of the country are concerned. An oxygen plant with a flow speed of 1,000 litres per minute is expected to become operational at Delhi's All India Institute of Medical Sciences. 4 more by this weekend in top hospitals in and around Delhi. That should largely address logistical issues of transport and provide a big relief to COVID patients who are in need of emergency oxygen.
Setting up oxygen plants on a war footing. At Delhi's All India Institute of Medical Sciences, a medical oxygen plant is getting installed and operational within 48 hours. By Thursday, the plant developed by India's Defence Research and Development Organisation (DRDO) can cater to 190 patients at a flow rate of 5 litres per minute and charge 195 cylinders per day.
The first 2 units have rolled out of the factory and they have come to Delhi yesterday, and today they are being installed in All India Institute of Medical Sciences and RML, and in all probabilities you should be start working tomorrow onwards. The capacity of this oxygen plant is about 1,000 litres per minute.
By the end of the first week of May, 4 more such medical oxygen plants are expected to come up at Ram Manohar Lohia Hospital, Safdarjung Hospital, Lady Hardinge Medical College and at AIIMS in Jhajjar, Haryana. It is a war of a different kind against the virus, and interestingly, the medical oxygen plant technology developed by DRDO is based on the on-board oxygen generation for light combat aircraft Tejas. Over the next 3 months, 500 such oxygen plants are to be set up across the country, funded by PM CARES. At Dharamshila Narayana Hospital in Delhi, this oxygen plant, donated by France, has been installed and made operational within a record 18 hours. This can refill 48 cylinders of 40 to 60 litres capacity in 24 hours. With Rajiv Ranjan and Sharat Sharma, Usama Shah for NDTV.
Welcome back. You're watching Good Morning India. I'm Rishika Barua. The big story we're tracking for you this morning: a third wave of coronavirus could be inevitable. This is what the government's top scientific advisor has said on Wednesday. He's also warned that vaccines will need to be updated to deal with the new strains of COVID that have overwhelmed hospitals and left thousands dead. Now, asked if a nationwide lockdown was the only solution to contain the unprecedented rise in cases, Niti Aayog member and chief of the National Expert Group on Vaccines, Dr. V.K. Paul, has said that if anything more is required, those options are being discussed.
जब वायरस का स्प्रेड बढ़ता है, एक्सेसिव होता है, तो चेन्स ऑफ ट्रांसमिशन को रोकने के जो बाकी एफर्ट्स हैं उनके साथ में रिस्ट्रिक्शंस को भी बीच में लाया जाता है। और इस कॉन्टेक्स्ट में 29 अप्रैल को डिटेल गाइडलाइन इशू करी गई हैं। दोज ऑप्शंस आर always being discussed, and those decisions as required will be taken. But at the same time, remember, this already there is a very significant guidance to the states to impose and impose restrictions in order to suppress the chains of transmission.
Where does SARS coronavirus 2 go from here? A phase 3 is inevitable, given the high levels of circulating virus. But it's not clear on what time scale this phase 3 will occur. Hopefully, incrementally, but we should prepare for new waves. Previous infections and vaccines will cause adaptive pressure on the virus for new kinds of changes which try to escape it. And therefore, we should be prepared by scientifically to take care of that. So B117, other variants like 617 are accumulating changes which show excellent vaccines, on which vaccines show excellent efficacy, but ongoing surveillance is needed and vaccine updates as we go ahead with new kinds of variants are inevitable.
All right, so that's of course the alarm that's been sounded. The third wave of COVID is something which is in fact inevitable. Let's take a look at the positivity rate in India at the moment. It continues to be a worrying story as far as states and union territories are concerned. Most states, union territories in the country have a positivity rate of over 5%. Now, the number of tests that are turning out to be positive almost pan-India is 5%. But 24 of these districts, the positivity rate is very high. Goa is the worst hit, 48%, Haryana at 37%, Bengal at 33%, and Delhi at 32%. There are 24 districts in the country right now that are reporting above 15% positivity rate. Well, let's now shift our focus to Maharashtra, which, remember, continues to be the worst hit state in terms of the coronavirus numbers, the total numbers. Maharashtra on Wednesday has reported a record 920 deaths from COVID-19. Now, more than 57,000 new cases have been reported in the state, and authorities, however, continue to say that some of the worst affected districts in the state are showing a declining trend in infections. Now, these figures come on at a time when the Supreme Court actually praised Maharashtra's handling of the second wave of infections, recommending that notes from the Mumbai model could be tried and applied to Delhi as well. Now, it's also refused to stop the High Court from monitoring the oxygen situation. The Maharashtra Health Minister Rajesh Tope on Tuesday evening said that 15 districts in the state, which were the worst hit and with around 6.6 lakh active cases, these districts importantly are showing a decline in total number of coronavirus cases. So, cases are declining, but the number of deaths in Maharashtra are hitting a record high.
हाँ, ही गोष्ट खरी आहे की महाराष्ट्रामधल्या काही जिल्ह्यांमध्ये रुग्णवाढ थोडीशी उतरायला लागलेली आहे, पण त्याचबरोबरीने काही जिल्ह्यांमध्ये रुग्णवाढ थोडीशी व्हायला लागलेली आहे. आता केंद्र सरकारच्या विज्ञान विषयक सल्लागारांनी एक इशारा दिलेला आहे की देशामध्ये तिसरी लाट येते आहे, सावध राहा. सावध राहा म्हणजे काय करायचं, तर नवीन काही नाही आहे त्याच गोष्टी. आपण काय करतो आहोत, सावध काय राहतो आहोत.
Now, the Supreme Court has set a deadline for the centre on an oxygen plan. The Supreme Court has said that a comprehensive plan is needed for the national capital and set a deadline, in fact, of 11 a.m. The centre has to submit a plan today by 11 a.m. on how it plans to supply 700 metric tons of oxygen. Now, the centre has said, the Supreme Court has said that the centre must submit this plan by 11 a.m. Also, to examine the Mumbai model and learn from it. High Court's contempt notice to officials so far has been put on hold. All right, let's get an opinion from our expert doctors joining us on the broadcast. We have Dr. S.S. Bansal, Managing Director of the SSB Hospital in Faridabad. Dr. Bansal, thanks so much for sparing the time and being with us on NDTV. Couple of important issues. Firstly, I want to address the issue of the oxygen emergency because that continues to remain a very, worrying story. Now, there are certain measures that have kicked in terms of medical oxygen, coming in from abroad, naval warships being deployed for the same, the DRDO plant that's been set up at AIIMS. How far do you think these measures go in ensuring a steady supply of medical oxygen to the national capital region?
I'm very hopeful that these measures will be extremely helpful in ensuring the oxygen supply to Delhi as well as the other areas, because we have faced a crisis of oxygen in the last week, and we have seen that when there is a coordinated effort from the government side, then the crisis can be handled very nicely. For example, in our hospital last week we had a serious crisis because I have around 150 patients who are on oxygen, who are dependent on oxygen in my hospital at SSB Heart and Multi-Speciality Hospital Faridabad. And these patients were really requiring very high level of oxygen.
Right.
And many of them were on ventilator and many of them were on, other support systems like BiPAP. And suddenly, the oxygen supply, went off, it ran out. But because when I called, the deputy commissioner of the city was taking the calls directly.
Right.
And when I called him, immediately the oxygen supplies was rushed.
Okay.
The oxygen tanker was rushed to the hospital and we could save all the 40-50 patients who were totally dependent on the oxygen. So all these coordinated efforts like, the oxygen express train.
Yes.
And then, the airlifting of oxygen by Air Force, then the Navy ship carrying oxygen. Now, the most important thing is the distribution of oxygen.
Okay.
And the other important thing is that there should be a nodal officer whose number should be displayed and should be given to all the hospitals so that, wherever the oxygen crisis is there, the oxygen can be rushed to that.
Yes, I think Dr. Bansal, you raise a very important point, and anecdotally, I mean, you've been through the exact same thing at your hospital.
Yeah.
While, of course, there's been an effort, to ensure that the supply is there, the distribution is actually very, very important. I want to also bring in Dr. B.V. Manjunath. He's joining us on the broadcast from Mangalore. He is the head of cardiology at the AJ Hospital. Thanks so much for being with us. I want to ask you, Dr. Manjunath, about the other big development we're tracking, which is the fact that the chief scientific advisor to the government has warned, in fact, in no uncertain terms, that the third wave of COVID is also inevitable. So we are going to have to brace for a third wave. How are you looking at these developments, given the fact that our healthcare infrastructure is already stretched out thin?
Thank you for inviting me to the panel discussion. Of course, this is a little worrisome point because we did not expect the second wave last year. Now we are expecting a third wave, probably in the month of October. But the second wave have to wane off by the time we are geared up for the third wave. Of course, I feel that basically the vaccination should be an answer to face the third wave, because by the time we get into the third wave phase in October or November, we should ensure that most of us are getting vaccinated. As per the data released yesterday, the vaccination drive has come down by 50% in Karnataka. Because 38 lakh was last month vaccination data, but this month it's only 18 lakhs. So that means because of the non-availability of the vaccines, probably now initially there was a hesitancy by the people to get vaccinated. Now there is an urgency by the people to get vaccinated, but the vaccines are not that available. But of course, I feel that only solution for the present problem is vaccinating as much as possible, as early as possible.
Right. Vaccinating as many people and as early as possible. Dr. Bansal, as far as the National Capital Region is concerned, for instance, one is seeing that vaccination centers have opened, at least in Delhi they've opened. In fact, most government schools have been converted into vaccine centers. However, the availability of slots, a lot of people have registered on COVID, but the availability of slots continues to remain a challenge. I want to also ask you, about what's been said in terms of the fact that vaccines will need to be updated. This is also something that the Chief Scientific Advisor has said, that our vaccines are going to have to be updated to respond to the mutant strains. What can you therefore tell us about the current vaccine efficacy against the double mutant that's been found in India?
Yeah, Rishika, this is a very, very important question, because what we have seen is that after first dose of vaccination, we are seeing so many patients coming up with COVID infection.
Yes.
And we have seen so many patients coming up even after second dose of vaccination was administered. Even after that, there are many patients who are coming with COVID infection. So there is an urgent need to update our vaccine, because there are certain mutants, certain strains of viruses which are not adequately covered by these vaccines. So it's a very, very important aspect that we should keep on, modifying the vaccine, keep on upgrading it so that it covers the new mutants and the Indian mutants. And even this company, which is called Moderna company,
yes,
they have come up with a new vaccine. And this new vaccine is basically a modified vaccine, and it is covering the South African strain. And it is also covering one more strain.
Right.
So it's providing additional protection against the new strain. So the same thing needs to be done in our country as well. And moreover, I would suggest that because there is an extreme shortage of vaccine supply, I would request the government to focus mainly on the areas where the surge is too much, where many cases are being reported. And first, the vaccination should be diverted to those areas, and the preference should be given to those areas so that the transmission chain can be broken.
Right. Dr. Bansal, do you agree with the fact that areas which are seeing a very high case positivity rate, and we know that there are, there are several districts in India, almost all districts in India that have over 5% positivity rate, but the positivity rate is touching 50%, crossing 30% in a majority of districts in the country. Do you believe, Dr. Bansal, that the current, Dr. Manjunath, actually, if I can bring this question to you, do you believe that the current containment strategies, which are very localized, are enough?
I think it is not enough, because if you look at the Karnataka figure, yesterday we crossed almost 50,000 cases, and out of which half of the cases are in Bangalore urban areas. Now we are already having some type of lockdown in Karnataka state, but I feel that this lockdown is not sufficient, because there is always overcrowding when there is a relaxation between 6 a.m. to 12 noon. There is a relaxation for the people to go and buy. So there is always overcrowding, I feel. I think the stricter lockdown system will help to break the chain. Otherwise, this I feel is a partial lockdown which is not going to help us.
Well, almost every doctor we've spoken to on the broadcast from a medical point of view has said that a stricter lockdown and containment strategy needs to be put in place to contain the current spread of COVID-19. Thank you, doctor, so much for sparing your valuable time and being with us on NDTV. We're going to continue to keep a close watch on those developments. Short break here. We'll be back with more news on the other side. Stay with us. Welcome back. A big update that's coming in from the United States at the moment. The US has approved temporary waiver of patent protection rules on COVID vaccines. That's been proposed by India. Joe Biden has been under intense pressure from the world leaders to agree to waive protections for vaccine manufacturers in order to be able to ramp up production and get the jabs out to more countries, as currently rich nations have taken up a majority of the doses. So India and South Africa had approached the World Trade Organization in October, calling it to waive parts of the agreement which protects vaccine manufacturers, protects the patent of these vaccine manufacturers. This is a decision now that could go a long way in actually speeding up inoculation drives worldwide. It's a very significant development that's taken place in the United States. We'll get you more updates on this story in just a bit. But let's shift our focus to the other big development that we're tracking from Kerala. Now remember, Kerala is a state that is reporting a worrying spike in daily COVID cases. It is for the very first time that Kerala has crossed the 40,000 cases mark. Kerala is currently reporting almost 42,000 cases on Wednesday, 41,953 to be precise. Chief Minister Pinarayi Vijayan has in fact raised concerns over the fast decrease in oxygen supply in the state. My colleague Sneha joins us with the very latest as far as Kerala is concerned. Sneha, it is a worrying story in terms of the spike in numbers, but also the Chief Minister there flagging the depleting oxygen reserves in the state.
Well, that's right, Rishika. In fact, Kerala is continuing to record the daily highest numbers in terms of COVID-19. And of course, Chief Minister writing to the Prime Minister for around 1,000 metric tons of liquid medical oxygen to augment the capacity or the availability in the state. But the district which is recording the highest in Kerala is Ernakulam district. It's the business capital, tourist hotspot, also a district with a lot of migrant workers from across states. And joining us right now is the District Collector of Ernakulam, S. Suhas. Well, thank you for joining us, Mr. Suhas. First question to you. The visuals of what you shared on Facebook of the very high-tech COVID war room has, of course, gone viral. A lot of people appreciating that. But, Mr. Suhas, what has changed over the last 2 weeks? What's the kind of calls that you're getting, the responses that are being forced from the war room, or just the struggles? What has changed over the last 2 weeks as the cases have been surging?
Well, this time it has been a challenge compared to the first wave because of mutant strain, and the cases have surged. So our main intention is to ensure rationality in allocation of beds and also monitoring of oxygen in all government and private hospitals. So what we do is we have a bed shifting system and also monitoring of oxygen of all the hospitals. So whenever we get distress calls, we try to see whether the person can be treated at home through telemedicine, or in case if he requires any treatment as to what kind of bed he needs to be allocated. If he's a category A patient, we have domiciliary care centers, we have first line treatment centers where is allocated bed. In case if he's category B serious or if he's category C, then we allocate them to either government facilities which have oxygen or ICU beds, or we have a system of CASP in private hospitals. So we allocate the beds for in there. Mainly, our intention is to see that wrong people don't occupy the bed, and which results in the real who deserve it, they don't get it.
Right, of course, the triad system is the crux of the allocations in Kerala. But Mr. Suhas, I also saw in that COVID war room the oxygen monitoring wing, and that's something which every district has started doing now. It may not be as high-tech as it is happening in Ernakulam, but how is it right now? How fast is this oxygen being used? Is the supply, is the availability a challenge, or is it the supply? You know, how to get it from the supply point to the hospital as demand rises? What is the situation in Ernakulam?
See, we have two sources. One is liquid medical oxygen, which comes from Kanjikode in Palakkad, and also a small portion of it comes from BPCL as well. And the second source of oxygen is oxygen cylinders. So what we have done here is the state government has given us a lot of support, and they are ensuring that we get our requisite quota of liquid medical oxygen. But the challenge is to ensure that even the small hospitals get the cylinders at the right time. So what the control room does is, in case we come to know that there is some shortage in smaller hospitals with respect to cylinders, we have a transportation mechanism which ensures that cylinders from a buffer stock is immediately sent there, and it ensures that there is no scarcity in that particular area. So we are sort of ensuring that no private or government facility runs out of oxygen even after informing us. So this is the system which is set up. And in real-time basis, all the hospitals keep entering what is the burn rate of oxygen and how long do their stocks last. So accordingly, we can plan it and ensure that there is equitable distribution of oxygen.
Right, Mr. Suhas, we're totally out of time, but one question, and you'll have to answer this very quickly. A lot of panic calls saying that there are beds not available, oxygen ventilators not available. What's the situation? Quick answer, please.
Well, we are trying to ramp up more number of oxygen beds in the coming days. We have already started a facility near the source itself so that there won't be much of transportation issues. So once that comes up, I think that it will give us some kind of a cushion in the coming days. As I said, there is a lot of demand for beds, but it's about ensuring the right person gets the bed at the right time.
Well, thank you so much, Mr. Suhas. Challenging times, definitely. Back to you in the Delhi studio.
Thanks, Neha, for joining us. So, with that comprehensive update, breaking news that is coming in, India's reported over 4,12,262 COVID infections in the last 24 hours. Deaths at an all-time high, 3,980 deaths, almost 4,000 deaths being reported in the 24-hour period. The slight good news here is that vaccinations have gone up, almost touching 20 lakh vaccinations in the last 24 hours, 19.5 lakh vaccines as opposed to 15 lakhs in the previous 24 hours. The case positivity rate in India has also seen a slight dip. It was touching 25% yesterday. It is now at 21.5%. But 4.12 lakh cases being reported, 3,980 deaths. This is the highest cases and deaths for India in a 24-hour window. We'll get you more updates on this story. Short break here. We'll be back with more on the other side. Stay with us.